With the knowledge of early childhood development and then the addition of our research and the research of others, what we know is that there are 6 major risk factors. And if our children become available for our families by adoption or fostering, they've got at least some of the risk factors. The first risk factor is a difficult pregnancy. It can just be mom was stressed. It could be mom didn't have enough to eat. It could be there was argument between the mother and the biological father, or it could be that there was argument in her family of origin. But all of those things create profound stress on a developing baby's brain. It could be a difficult birth. Some children have protracted labors or forced labors. Some children have tiny hypoxic episodes where there's just a fraction of a period of time where there's a little oxygen deprivation. It's common in all children, but it's considered a hard place. Some children are premature and they have early hospitalization instead of nurturing care. Those 3 risk factors are very often overlooked when we think about our children coming home. The 3 risk factors that are easy for us to recognize are abuse, neglect, and trauma. But unfortunately, many of the children who come to us had a loading of risk factors, and some of our children have had all the risk factors. For families who adopt a child at birth, they think that will be a low-risk situation. But a child who has come home to us at 3 days of age will still have some loss to deal with. It's going to take on the part of parents tremendous insight and tremendous sensitivity. And we have to come to our children with great respect for where they've come from. Even if you were in the delivery room and held that child when they were 5 minutes old, that child has loss. And that child had some risk in utero. And we have to look at our children's behavior and remember that brain formation, trust formation, brain chemistry, sensory processing, all of those were determined the first year before birth and the first year after birth. We have to look at our child's behavior and always see where they have come from. Parents will say, well, my child can't possibly remember. I adopted them at 18 months of age. And I will tell you that the harm that is done before a child has brain maturation is harder for them to deal with than the harm that was done when they were 4 years old and they had maturity in the frontal lobes and they can say, I remember when. A child who didn't have care in the early days of life will say, I have a sense of hunger. I have a sense of loneliness. I have a sense of danger. But that child can't retrieve a concrete memory to deal with. That doesn't mean it's not there. And we always have to look at our children through the eyes of their history. We have to deal with behavior. We have to be proactive about behavior. But we must never forget where our children have come from, because it is always influencing their thinking and their feeling and how they believe. One of the really important things for parents is to remember that everything that they do with their children, everything that they face with their children, they've got to look with eyes of compassion. You can't just see the behavior. You have to understand and remember always that child's history. We talk in our book about having compassion as your touchstone. When you don't understand a behavior, go back and stand and look through the eyes of your child. I love the story of Jesus standing in front of Lazarus' grave. He knew full well he's fixing to call that boy forth from the grave. But his sisters wept, and Jesus wept with him, not because he didn't know what was fixing to happen, but because he had compassion and he felt their pain. We must never forget where our children have come from. And we must always look with God's eyes, and that will be eyes of compassion.